Today, a CDC panel ended universal recommendations for the COVID vaccine, marking a major shift in policy under Health and Human Services Secretary Robert F. Kennedy Jr. The vote took place on the second day of meetings in Atlanta. Our Danny Spiewak joins us now to explain what it means here. Danny?
Marina, the move may have limited impact here because under state law, Minnesota is not bound by this panel's recommendations. In fact, shortly after the vote today, the Minnesota Department of Health issued its own guidance, recommending broader use of COVID vaccines.
For the past 2 days, a CDC advisory committee has been meeting in Atlanta to discuss recommendations on a number of vaccines. At times, the panelists appointed by Robert F. Kennedy Jr. have clashed with groups like the American Medical Association.
And it's troubling to see the erosion of the committee's integrity.
The panel's chair, Martin Kulldorff, defends the committee's work.
They criticize very severely of saying that we are dangerous and unscientific, which is completely false.
In a break from past guidance, the CDC panel on Friday voted to end universal recommendations for COVID shots. While stopping short of requiring prescriptions, the committee recommended that people consult a healthcare provider before getting a vaccine.
The feeling is that there's a little bit of chaos at the CDC right now.
But as Dr. Jill Foster with the University of Minnesota Medical School points out, Minnesota has separate guidance on COVID vaccines. The Minnesota Department of Health recommends COVID shots for all kids younger than 2, older kids with higher risk, and all adults 19 and older.
Minnesota is looking at the organizations like the American Academy of Pediatrics and Infectious Disease Association of experts who have reviewed all of this and are making recommendations.
The conflicting recommendations can be difficult to follow, especially for parents making decisions about their kids.
This is confusing, and it can be confusing for people who have a medical background.
Dr. Liz Plachek with Children's Minnesota encouraged parents to ask questions.
Your pediatrician is a trusted source. We love to talk about vaccines and really can understand a lot of this language.
The acting CDC director must now sign off on these recommendations. Dr. Michael Osterholm, of course, with the University of Minnesota Vaccine Integrity Process, has been, one of the nation's leading voices on vaccines. And today, he accused the CDC panel of being, quote, hijacked and becoming an ideological body. But Rena, just still a lot of uncertainty and questions about this, but this move was pretty expected from the panel today.
Two things that I wanted to ask you about. A lot of people thought this was going to go even further, didn't they? So, I mean, I guess it's not as strong as of an outcome as we thought it was going to be.
Sure, there was some thought that perhaps the panel would say that somebody shouldn't have the COVID vaccine. What they obviously came up with today and voted on was that you need to consult with a healthcare provider no matter what age you are, but they did say that they no longer have these universal recommendations, which is notable.
And the FDA came out recently and said only people over 65 and underlying conditions should get the COVID shot. Is there some confusion now as to who's eligible?
Yeah, it's kind of unclear because that was the approval for those vaccines, that was last month, late August. And so it's kind of unclear at this point what that means versus what this committee's decision was today.
All right, Danny, thank you.